Now, as members of provincial parliament returned to Queen's Park, several thousand people gathered on the lawns outside. They say there's a healthcare crisis in this province, and they're calling on Premier Doug Ford to fix it. As Emily Taylor tells us, advocates say the first step is reversing the government's push for privatization.
No privatization of healthcare in Ontario. That's what protesters in front of Queen's Park today are asking of the government.
You can look around today, you see how many people are here at this rally and protest today for the privatization of healthcare. That is not acceptable in Ontario.
Around 80 buses brought in several thousand people from right across the province, right here to the lawns in front of Queen's Park for the rally. Earlier this year, the Ford government passed a bill allowing private for-profit clinics to perform minor procedures like cataract surgeries and MRI scans. It's part of the Ford government's pledge to reduce provincial surgical backlogs. Ontarians can use their health card to access the services, but advocates are concerned it will divert staff and government money away from the public system, which is already understaffed.
We don't have enough nurses, we don't have enough doctors, we don't have a PS, it is a human resource issue. Having said that, rather than put resources into our operating rooms or into our hospitals or our community clinics, this government has chosen instead to put it in the pockets of shareholders. That's precious dollars, public healthcare dollars that we need directly in healthcare today.
That includes in the Golden Horseshoe.
We see the wait times, we see people struggling. We know that people can't afford, to pay extra to get the extra what they need in the healthcare system.
We all work in hospitals. We see that the issues that are happening, we see services leaving the hospital.
Earlier this year, Niagara Health announced urgent care centers in Port Colborne and Fort Erie would permanently shorten their hours to close overnight in order to redeploy staff across the region.
There shouldn't be one hospital service closure in Niagara, not in Hamilton, nowhere across Ontario. There's no surplus capacity. So the fact that we're seeing cuts to the public hospitals, these massive, major closures like emergency departments, what could be more of an emergency than having 500 emergency department closures in Ontario?
The opposition says they'll continue to bring up the topic in question period. Emily Taylor, CHCH News, Queen's Park.